everyone. This is Dr. Anokhi Khanum from the Apple Pediatrics. This is the Health Scooter Series live chat with Dr. Richardson on allergies and eczema. Hello, Dr. Richardson. Welcome
Hello,
again.
how are you? Yes, how are you?
I'm good. How are you doing?
Very good, very good.
How's
So
the
we're
weather
at
in
it
Houston?
again.
Yeah. How's the weather in
Well,
Houston?
it cooled off a little bit. We had a big rainstorm and then it cooled off.
Yeah, I know. I was being told it's winter has arrived there. We're still waiting for winter to arrive here. But from a seasonal point of view, it already is, because the temperature is already starting to cool off. So you're seeing a lot of your usual runny noses and coughs.
Yes.
All right. Now, on that note, I think we should just dive straight in.
Okay.
On allergies. So, Dr. Richardson, what are allergies?
Okay, an allergy is basically the body reacting to something that the immune system has viewed as like a foreign attacker. And so the immune system starts charging against it. And when the immune system does that, different chemicals get released that like called histamines and things like, and leukotrienes that actually start making your eyes water, making your throat itch, making your nose run, making you sneeze. And if you have asthma, you can even start wheezing if it goes from the upper airway down to the lower airway. So basically, we're talking about a reaction that the immune system is having to some kind of invading substance like a pollen or a bee sting or something like that, or even a food allergy or something that could cause a reaction in the body. Yes.
Yeah. And in Karachi, we have a lot of dust, so we see a lot of dust mite allergies. And we have a very high rate of pollution.
Okay.
So, I mean, I think that also, I mean, do you agree? I think that also plays some role in
absolutely.
causing havoc.
Yes, when you're talking about ozone and car exhaust and ozone, and these things can be irritants, strong fumes in the air that can be irritants to the airway. Of course, cause your eyes to burn or itch or sting or water, your nose to run, things like that. Itchy throat, all of that. Yes.
So, allergies what are the different types of allergies that people can have? So,
well, you can have what's called environmental allergies. Whatever is triggering your symptoms, they're all in different classes. So you can have environmental allergies, which are things like that basically float in the air, pollen, dust, like you said, dust mites, the little insects that live in the dust. And then you can have environmental odors like strong fumes. That can also be an irritant. Then you can have food allergies where a person may ingest a certain food and that then triggers, again, that response from the body saying, hey, get out of here. And the body kind of goes into attack and tries to get that out. And these are usually like little components or proteins in certain foods. And sometimes you'll find that if the food is fresh or raw, you'll have a problem with it. But if you cook it, which then kind of neutralizes the protein, you won't have a problem. So a person may have allergy to an apple, but if it's cooked in a pie, then they won't have a problem with it. So it's usually like the fresh fruit.
Yeah. So I think it's just important to highlight there that please, if your child, it's only if your physician has said to cook the food and then feed it, you should do that. But if the child has a severe form of allergy to a food product,
avoid it completely.
Avoid it completely. So I have exactly what you're describing as an oral allergy. I can't eat some of these raw fruits because it causes a lot of discomfort in the mouth, sore throats, sometimes a little bit of tummy ache, but it never gets severe. And we know those allergies never do. But when you cook the food, it's completely fine. But it's just important to differentiate because I don't want parents to go start cooking foods that their child is allergic to.
That's only true about fruits. Now, if we're talking about tree nuts, peanuts, and things like that, whatever form they're in, there are some people who can't even be in an area where they're even being handled because that's enough to get them sick. So they're definitely, if you have a food allergy, the key protection is avoidance. And then you can have allergies to medications. The most famous one people know about is penicillin. but some people can have allergy to sulfa medications and other medications. You can have allergies to medications. You can have eczema, which is like where your skin is super sensitive to things that come in contact with it. And then you can also have a skin contact type of allergy. And that's where, you know, like different metals like coins or jewelry, different soaps or anything that can touch the skin and then irritate the skin, that can be a problem. A real important one is latex allergy, which is important when you're talking about baby nipples, pacifiers, things of that nature. If your baby is allergic to latex, that can sometimes be very serious. It's very important they label the charts in the hospital because that's a very serious allergy, latex allergy. So,
so what do the kids, I mean, what do the kids, because this is one of the questions parents are going to ask, because you're highlighting latex allergy. So if a child is on a bottle that has latex in it, I mean, what do you see?
I mean, you may see where their lips get swollen when they're using the bottle. Sometimes babies that are using pacifiers, and where the two areas where the pacifier touch their cheeks, that area will become very red and irritated. So, and then of course, if you put a Band-Aid on the child and that has latex and to latex, that you would see where the Band-Aid is, that area would get red and swollen. So if there's any question that there's and as a matter of fact, you can even see some products even have latex free on them. So any plastic looking product, if you think that your child has a problem with that, you want to make sure that it's actually labeled that it's latex free to avoid that.
Yeah. Okay. All right. So we've gone the different, we got the environmental allergens, we got the contact allergens, and we got the food allergens. Okay.
And medication. Yeah.
Medication allergens. Yeah.
Oh, and another one is bee stings and insect venom. Bee stings can be very serious, and if you have a problem with that, you know, you would need to have that EpiPen, the one that works quickly, those self-auto injectors. You need to have that. Anybody that has serious food allergies to bee stings, and these are usually identified once you have had a consultation with an allergist, or if you have one episode, you definitely want to get with an allergist so that you can protect yourself in the future.
So we don't have pediatric allergists as such in Pakistan, Karachi. So the patients usually come to me, and obviously I ask you for advice if I get stuck anywhere. But yeah, another important thing to highlight about allergies. So if the patient has been exposed to it once, I mean, like for example, with food, when we tell our parents, when we're starting on solids, we tell them we're starting solids. Went off the phone.
3 times a day, so like 3 to 5 days in a row. That way they can know if the child had some kind of reaction. If the child has some kind of reaction to the food, you will know because you're giving you test each food individually. 3 times a day for 3 to 5 days in a row. That way you'll know.
No, yeah, exactly. And it's I think it's important to highlight that it may not be on the first exposure, because then I'll have parents start adding everything in, and I'm like, no, you need to do one thing at a time so that you can identify easily. And it may not be the first exposure. The first exposure, the body first recognizing that, oops, I don't like this. And the subsequent times is when
you get the actual reaction. Exactly.
Yeah. So if, for example, a child has eaten something this morning and tomorrow morning they start throwing up, would that be an allergy to what they ate this morning?
Not necessarily, because usually it's within a couple of 30 minutes to about 30 minutes, no later than about 4 hours, because you usually have that quick reaction to that. So you would know immediately. You would.
Yeah. So that's also something that I thought was important to highlight, because you get a lot of parents who come in, they're like, but I thought yesterday afternoon they ate something and they're vomiting now. And I'm like, no, it's usually within 2 hours you see profuse vomiting, diarrhea, or a skin rash. And as you said, mostly within 30 minutes. So we've done food allergies. Environmental, the allergies that causes your runny nose and watery eyes and things like that. So tricky question.
Mm-hmm.
It's winter. So you're going to see a lot of runny noses and watery eyes and sore throats. Does that necessarily mean that we have so many kids who are coming down with allergies in winter?
Well, no. Usually, it's the key with allergy. A lot of times is itching. You'll have an itchy throat, itchy eyes, or your nose is itching. If you have a cold, your nose will be running, but you won't have itching. Your eyes won't be itching. The key with allergy is that there's itching because there's irritation. So if they're just having a runny nose, that's not allergy. In the wintertime, children can get exposed to viruses. You can have 7 to 9 colds in a season, and it usually takes you about 7 days for the cold to run its course. So if you pick up one virus and then a week or so later you pick up another virus, it can look like every time you turn around the child's nose is running. But you simply just want to rinse the nasal passages, just kind of make sure your children are washing their hands, because hand sanitizer doesn't get rid of all the germs. You really need to wash your hands. I always tell them, sing the happy birthday song. That's how you can easily know 20 seconds. You want to wash your hands, rub them together, and then rinse them for 10 seconds. And that way you can be sure that you're getting any germs off of your hand to pass it, because everybody inadvertently touches their face, touches their nose, and that's an easy way to spread germs from one person to the other.
So as you said, important to highlight in the winter months, your child, especially the younger ones, it's normal for them. I'll just say in Urdu for the Urdu speaking my Urdu speaking patients, सर्दियों के महीने में ये कोई जब बच्चे को नाक बह रहा है, आंखें लाल हो रहे, खांसी हो रहा है, इसका मतलब नहीं है कि विंटर के मंथ में सर्दियों में एलर्जीज हो रहे हैं। सर्दियों के महीने में छोटे बच्चे को ये नज़ला जुकाम हो सकता है 2 दफ़ा महीने में, पूरी सर्दियों में हर महीना दो दफ़ा नाक बह रही है, जुकाम, नज़ला, ये बहुत नॉर्मल होती है और इसका मतलब नहीं है कि बच्चे को एलर्जी हो रही है। And another thing important I think to highlight is, do antihistamines or any of the allergy medications that we're going to talk about right now have an effect on your viral colds and coughs?
Well, no, they don't have an effect on that, because what's driving the antihistamine, what it's combating, is the release of histamine. When you have a runny nose from a cold, there's no release of histamine, so there's nothing for the antihistamine to work on. So basically, you just want to kind of keep the nose moist. You wipe it, use Kleenex and use once and discard. That way, you don't like using a handkerchief. You could end up reinfecting yourself.
So मैंने अभी पूछा था कि जब बच्चे को नज़ला जुकाम होते हैं, दवाई देने से कोई फ़र्क पड़ता है, स्पेशली वो दवाई जो एंटीहिस्टामिन कहलाते हैं, तो कोई फ़र्क नहीं पड़ता है। आपको बस नाक को वो एक बोतल आती है नॉर्मल सेलाइन की, नॉरसेलाइन या ऐसे कुछ, बस नाक को साफ करनी होती है, देखना कि बच्चे अच्छी तरीके से पानी और दूध पी रहा है, अच्छी तरीके से खा रहा है, और हाथ धोना है। हाथ धोना बहुत ज़रूरी है। Okay, all right, so we've touched on medications. So what are the medications for allergies?
Okay, well, there's several classes of medications that are used for allergy, and they're all targeted at either eliminating the symptom or trying to control the symptom. So the antihistamines are kind of like the first line, because a histamine is a very powerful chemical in the body that keeps the allergic response going. So if you can take medication to kind of taper that down, that really helps. You want to use the antihistamines that are non-sedating. That's kind of the ones that won't make you sleepy and drowsy. Especially if the child is in school, you don't want the child sleeping in school because they're taking medication that's making them drowsy. Now, sometimes the antihistamines may not be enough. No.
Do you have the generic names of the antihistamines?
Yeah, well, we're talking about either loratadine or the cetirizine. Yeah, those are the ones that are very common over the counter. You don't even need a prescription for them, and they are very